Poliomyelitis, commonly known as polio, is caused by the poliovirus. The disease has existed for thousands of years. Ancient Egyptian paintings and carvings depict individuals with withered limbs that are characteristic of polio survivors. However, the clinical and epidemiological description of poliomyelitis as a distinct disease entity is relatively more recent. The first clinical description of poliomyelitis was provided by Michael Underwood in 1789, where he referred to it as a debility of the lower extremities. The disease began to appear as larger epidemics in the late 19th and early 20th centuries. The virus itself was first isolated in 1908 by two Austrian physicians, Karl Landsteiner and Erwin Popper. They achieved this by injecting material from the spinal cord of a boy who had died from polio into monkeys, which subsequently developed the disease, proving that polio was caused by a virus. The discoveries and subsequent research paved the way for the development of vaccines in the mid-20th century, which have been instrumental in dramatically reducing the global incidence of polio. Poliomyelitis, or polio, is caused by the poliovirus, which primarily spreads and infects humans via the fecal-oral route. Here's a breakdown of the route of infection. Ingestion. The primary mode of transmission is through ingesting contaminated food or water. This happens when traces of feces from an infected person, containing the virus, enter the mouth of another individual. This can occur due to inadequate sanitation or hygiene practices. Initial replication. Once ingested, the poliovirus first infects the cells in the oropharynx, the middle part of the throat, and the intestinal mucosa. Viremia. The virus multiplies in these cells and then enters the bloodstream, leading to a condition called viremia, where the virus is present in the blood. Nervous system invasion. In a small percentage of cases, the virus can breach the blood-brain barrier and infect the central nervous system, CNS. Within the CNS, the poliovirus specifically targets and destroys motor neurons. This destruction is what leads to the paralysis observed in some polio cases. Excretion. Infected individuals, regardless of whether they show symptoms, excrete the virus in their feces. The virus can be excreted for several weeks after the initial infection. Secondary transmission. If sanitation is poor, the virus can contaminate the environment, including sources of drinking water. Other people can then become infected by consuming this contaminated water or food, or through person-to-person contact. Respiratory spread. Though less common than the fecal-oral route, the poliovirus can also be spread through respiratory secretions, such as from sneezing or coughing. It's worth noting that many polio infections are asymptomatic or result in only mild symptoms, so individuals may not be aware they're infected and spreading the virus. This silent spread was one reason why polio was such a significant public health challenge before the introduction of vaccines. Poliomyelitis, commonly known as polio, is an infectious disease caused by the poliovirus. A significant aspect of polio is that many infected individuals don't exhibit any symptoms. However, for those who do develop symptoms, they can range from mild to severe. Here's a breakdown. Asymptomatic. The majority of people infected with the poliovirus will not show any symptoms. It's estimated that about 90–95% of cases are asymptomatic. Minor, non-paralytic polio, abortive poliomyelitis. Roughly 4–8% of polio infections result in minor illness, which does not involve the central nervous system. Symptoms are flu-like and can include slight fever, fatigue, headache, sore throat, vomiting, neck and back stiffness, muscle tenderness and spasms. These symptoms typically last for 2 to 10 days and then completely resolve. Non-paralytic aseptic meningitis. In this form of polio, the virus spreads to the meninges, the membranes covering the brain and spinal cord, but doesn't enter the central nervous system to cause paralysis. Symptoms can include higher fever, severe headache, neck, back and muscle pain, stiffness of the neck and back, fatigue and irritability. These symptoms generally last from 2 to 10 days and are followed by complete recovery. Paralytic poliomyelitis. This is the most severe form but occurs in less than 1% of polio infections. The virus invades the central nervous system and destroys motor neurons, leading to muscle weakness and acute flaccid paralysis. This can occur over a few hours to a few days. The severity can range from partial to complete paralysis. Symptoms include high fever, severe headache, neck and back stiffness, asymmetric muscle weakness, typically more pronounced on one side. Flaccid paralysis. Muscles become weak, floppy, and poorly controlled. Muscle pain and tenderness. Difficulty swallowing and breathing in severe cases. Within paralytic poliomyelitis, there are further classifications. Spinal polio, most common form, affecting the spinal cord and leading to paralysis in the limbs. Bulbar polio, affects the cranial nerves and can lead to paralysis of muscles needed for speaking, swallowing, and breathing. Bulbospinal polio, a combination of spinal and bulbar polio. Post-polio syndrome, PPS. This is not an immediate symptom but can appear decades after the initial infection in individuals who've recovered from a paralytic attack. It's characterized by a gradual weakening of muscles that were previously affected by the polio infection. It's important to note that the introduction and global efforts in administering the polio vaccine have dramatically decreased the incidence of poliomyelitis, with many parts of the world now free from the wild poliovirus. Polio is caused by a virus, and there's no specific antiviral treatment that can cure poliomyelitis. Instead, the treatment for polio is supportive, meaning it's aimed at helping the body recover and managing symptoms. Here's a general overview of the treatment approach for poliomyelitis. Hospitalization. In cases of severe symptoms or paralytic polio, hospitalization is often required. This ensures that the patient can receive consistent monitoring and care. Pain management. Over-the-counter pain relievers, such as acetaminophen, Tylenol, or ibuprofen, can help reduce pain and fever. Bed rest. Rest can help in the recovery process, and patients are often advised to rest completely during the acute phase of the disease. Physical therapy. Physical therapy plays a vital role, especially for those with paralysis or muscle weakness. It can help improve and preserve muscle function, prevent deformities or contractures, increase mobility, maintain or improve joint function. Orthopedic support. Braces or corrective shoes may be required for individuals who experience foot drop or other limb deformities due to muscle weakness or paralysis. Respiratory support. In severe cases, especially bulbar polio, the muscles required for breathing can be affected. Mechanical ventilation or the use of an iron lung may be necessary to assist with breathing. Nutritional support. Patients with difficulty swallowing might require a modified diet or, in extreme cases, feeding through alternative means like tube feeding. Avoiding complications. Ensuring that patients move periodically, even if bedridden, can help prevent secondary complications like bedsores or a pulmonary embolism. Vaccination. Although it doesn't treat the disease, ensuring that populations are vaccinated against polio is the primary means of preventing its occurrence. If someone is suspected of having polio, they should be isolated and immunized, and their close contacts should also be immunized to prevent the spread of the virus. Post-polio syndrome, PPS, management. For individuals who experience PPS years after recovering from an acute polio infection, treatment can include physical therapy, pain management, and sometimes the use of assistive devices. It's crucial to understand that the best treatment for polio is prevention through vaccination. Thanks to global vaccination efforts, polio has been eradicated in many parts of the world.